Hello everyone. Today I am going to discuss about USMLE Step 2 CS examination, the patient encounter which is of 15 minutes, how to deal with it. Okay. Firstly, when you stand in front of the door, you'll be given what is a condition. You make a note of the what is a chief complaint, vitals which is abnormal, you make a note of it, and mainly you should make a note of the patient name, which is very important, and remember that name. And after noting all these 3 points, and just look at what is given. Generally the brief instructions will be do a quick history, and in some cases they will specifically mention that physical examination is not required in some cases. So just go through the question, and after you make a note of all these points which is written on the doorway, uh, you need you need to knock the door twice and wait for the response. If you get, open the door and go. If you don't get also, you can open and go inside. Enter with a smile, that is very important. Greet the patient, say him by his last name. You can call him Mr. or Mrs. X, XYZ, and ask him whether you're pronouncing his name right or wrong. Okay. And introduce yourself. uh, Introduce like by your last name, and say that you're a physician for today, and you will be going to ask a few questions regarding his health, followed by brief examination. uh, Ask him whether it is okay with him or not, and say that it's say thank you for allowing you to do that. And the next important is comfortability. Look for the comfortability of the patient. Ask him whether he's comfortable or not. Look for whether he's nicely draped or not. This is very important. And ask him whether is there anything else that you can do to make him more comfortable. This makes him relax and be comfortable to you. Okay. And then the most important is ask for a permission for note writing. This is important, because whenever he speaks you write it. You need to take a permission before you start writing notes. Ask him whether does he mind if you take notes while talking to him. That's important. And then start with an open-ended question, that how can I help you, Mr. or Mrs. XYZ, like that you can ask. And whenever he replies saying some complaint, say him that sorry to hear that. And you can more assure him that you are here to help him as much as you can. And tell him that you need not worry about it. You are in safe hands. You can tell like this. And ask him to continue. You can continue more about it, tell more about it, or you can ask him the specific questions related to that question. And if you don't understand the complaint in first go, then you can ask him what do you mean by that complaint, um, to get a more detailed information regarding that complaint. And thank him for sharing this valuable information with you. And the next one is, you need to, after you listen to him, you need to rephrase whatever he told to you so far, and tell him whether it's right, or you can correct me if I'm wrong. So that and then if he says it's correct, then you can make a note of it in briefly and very fast. And you can say that you want to ask few more questions to have a better idea what's going on wrong with you. You can say like this, so that you can continue with the next history taking part, where you can remember this mnemonic as OFDP, Liker, AAA, triple A, where O means onset, frequency, duration, progression, L is location, intensity, Q means quality, radiation, A aggravating, A allowing, A associated, anything associated. So you can briefly ask questions with this mnemonic, so that you remember very fast. Onset means you ask how did this start. Frequency you go with, is it continuous or episodic, like that. Duration you can ask like how, for how long you have been having this problem. And for progression you can say since it started, has it been the same or getting worse. And location you can ask, can you exactly locate the pain for me. And this liker, you remember this liker is only for pain complaints. You use this liker to know the location, intensity, quality and radiation of the pain. So whenever the complaint is not pain, you can avoid this liker, liker, asking this liker. So whenever for asking this intensity, you can say that on a scale of 0 to 10 or 1 to 10, how will you grade your pain, with 1 being the minimum and 10 being the maximum, you can say like this. And for quality, can you can ask like, can you please describe the quality of your pain. Radiation, you can say, does this pain go anywhere else, you can ask like this. And anything making it better. For any symptom you can ask this triple A. Anything making it better, anything making it worse, anything associated with it, you can ask this. And depending on DDs means differential diagnosis. If for a chief complaint you can have many diagnoses, differential, like you have an idea of differential diagnosis. So depending on the differential diagnosis you can ask the question, and it's related to DDs, and you can get an idea of what's happening with this patient. You can get up to a minimum of 2 DDs, 2 to 3. So, and then you'll proceed with general questions, which are of about 6 to 8 points, which deals with you can remember this mnemonic: Pam hugs Foss. Pam means P, past medical history. In that past medical history, past surgical history also involves. And A for allergies. And ma'am for M, M for medications. And H for hospitalization, U for urinary symptoms, G for GI symptoms, and S for social and sexual history, and F for family history, O for obstetric gynec history. And there is one more S here. You can say that you can ask for I mean, only two S can be considered here. S is for social and sexual history, and one more S is for screening. Screening test you can ask, depending on the age of the person. You can ask a screening test. Mainly for screening test you ask like pap smear, mammogram, colonoscopy and DEXA scan. Pap smear you ask for, if the pap and mammogram you ask for females. Pap smear is for females more than 16 to 21 years, and mammogram you ask if the female is more than 40 years. Colonoscopy you ask for both male and female more than 50 years. DEXA scan you ask for both male and female more than 65 years. So you can remember this briefly. Pam fast, so you don't miss all these general points in any patient. It's mandatory to ask all these in all the patients. And you can summarize briefly to the patient that what he has told so far, so that he's having so complaint, so and all the symptoms. And ask him whether he want to add anything, and ask him whether, and to correct if you're wrong. And thank him for all the for the cooperation. And and after summarization you can go for sanitizing your hands. uh, and during the sanitization of hands you can say briefly, you can ask briefly about his occupation. What do you do for your living? What do you eat generally? Is your diet and exercise? I can cover these points during the sanitization of points, so that you go with the time. And after this sanitization you need to do quick physical examination within 2 to 3 minutes, so that you'll complete. You do the specific examination related to the complaint. Example, if the complaint is chest examination, chest pain, you do the resp and CVS majorly. You can skip the other examinations. So mainly specific physical examination, you return to the specific examination, and after the physical examination you do the closure in 6 points, like you need to maintain all these 6 points. Firstly, empathy, say that, well, Mr. XYZ, thanks for your cooperation, and you say that if you have caused any inconvenience, you apologize him or her, and you give your diagnostic impression, and say it in simple language. Don't use the medical terms which he doesn't understand. Say in a normal language and say that depending on this history, on your history and examination, I'm thinking of two possibilities or two or three. You can say for your current complaint, it could be this or that. You can say that you say I'm not sure right now, and to make sure of it, you go for the labs. I need to run some tests, like depending on simple blood work, like complete blood picture and some imaging studies like x-ray, CT scan. Say, don't say CT scan also, you can describe what are the imaging studies, how they do also, briefly, if he doesn't understand. Okay, and if needed you can say like that, and say him that when the results arrive, we'll sit together and discuss further management plan, and you need not worry, and you can console him, and you say that you're in safe hands, and when the results arrive we'll deal with it together. You can use some of these words to make him better and understand and make him comfortable, and say that after the results are in, what will be your short-term management, that till the results arrive, the short-term management will be you'll keep him under observation, tell that like that, and say that you'll be given some medications or something like that, depending on the symptom you can say him, and long term management depending on the scenario, case based management you can describe him, if you have a DDs, differential diagnosis, and moreover at last you need to address about the risk factors also. Moreover, I would advise you should advise him to quit his smoking or cut down his alcohol, or like that, and tell him he should have a healthy diet, low in salt, like that. You can mention some general points and ask him to do regular exercise and eat a healthy balanced diet full of vegetables, fruits, and less in fat and salt. You can say these general words, and at the last you can ask him this: do you have any questions or concerns for me? And if he ask you, so generally they ask you questions when they have any doubt in the process of your examination or anything symptoms, and they will have some concerns, so they will express, so you need to answer them quietly, and consult him and ask them if they have any more questions, or if they say no, then you thank him, and say that you will meet again when the results arrive, lab results are available. Until then, bye bye, and you can say take care, like that. You can see simply. Hope you enjoyed this video. Thank you.